Ozempic, here's what they don't tell you. Oh man, I've been waiting to talk about this for a long time. I've kind of touched on it in different videos, but I'm gonna we're gonna go in depth into Ozempic because after seeing the effect of it has on society within the past year or so since its FDA approval, I've really kind of learned more about it, and I understand the consequences of it, and I've really learned what people just don't know about it. That's really unfortunate. People just don't know about it. And so it's rampant right now on social media, and there's every clinic and every physician who has a license is trying to prescribe it and create these weight loss programs. Unfortunately, they're preying on people who just are ignorant. They just don't know what they don't know, and they just want your money. And that to me is not what I do and what I believe in. So I'm here to help you. I will never recommend anything to you that doesn't work or is not going to help you. Like, I don't need your money. Like, that's just not me. That's not my style. Ozempic, let's talk about it. So what is it, right? So it's a GLP-1 agonist, and what it does, it kind of decreases, it's basically a hormone. It's a peptide, which is a protein, and that's a very powerful peptide, and it decreases the hunger stimulation in the brain. It actually works in your brain too, but also kind of increases the satiety sensation in your stomach. And so the end effect is you get full faster, and you don't quite get as hungry as you might have been before. Even to the point where you actually have like food aversion, like it just kind of makes you nauseous just by looking at certain foods. You know, there's some things that people just don't tell you. Like when you sign up for a weight loss program, they don't tell you these things. So if you don't believe me, just start searching YouTube and start, look at that topic. Like, what do they don't tell you? And this is I'm gonna touch on that, but I'm gonna touch on other aspects that maybe I think that people don't really talk about. So one thing, let's talk about what they don't tell you. One thing is a cost. Like, how much does it cost to have this medication prescribed on a monthly basis? It depends on, this is the disclaimer here. It depends on what kind of drug you're getting, right? Did you know that Ozempic is basically on back order? Like, they cannot produce enough. Wegovy, Mounjaro, like, they just can't produce enough. Those are FDA approved medications. Like, they are so behind that they cannot sustain the population demand right now. Since really the social media just like blow up in 2022, they just can't produce enough. And so what's the consequence of that? And it's so important people understand this, is that they're called compounding pharmacies. These compounding pharmacies start making up these concoctions, I'll call them concoctions, of a similar form of this peptide. And the FDA is okay with it, hence now it's a wild, wild west, is that there's pharmacy compounding companies all over the country and the world making this peptide, and you're hopeful that it's going to be similar to Ozempic, which is, again, it's a regulated medication. The similarity of the medications they're producing, these compounds, typically are associated with sodium. It's called basically semaglutide sodium, which it has this salt component to it. And there's no studies on it. There aren't. There are no associated studies on these compounds that they're making. But it does have similar effects. But again, it depends on who's making it, which pharmacy company is making it, this compounding pharma is making it, because they're not all created equally. That's what's scary to me, is that you're buying a product that could be made in India and you have no idea how they're making it, because there is no regulation. If they're not regulating them. And that's a whole nother topic of peptides. I can go into, I can get on a soapbox about that one. So it's really important you understand that you need to know where you're getting these medications from. And these compounding pharmacies typically are going to add in their cocktail to help decrease some of the side effects of like nausea. So they'll add these little extra things like B12, B6, and whatnot to kind of decrease the side effects. But it's not the same stuff that FDA has tested, and FDA approved, like the pharmacy companies that make Ozempic and Wegovy and Mounjaro. Totally different. So that goes back to the cost. So cost-wise, will insurance pay for it? Great question. Will insurance pay for Ozempic? The answer is yes. Short answer is yes, with the catch. The catch is that insurance will cover, some insurance will cover appropriate diagnosis for diabetes, okay? Unfortunately now, this medication is used for vanity, for those people who want to lose like 10 pounds. That is not a medical diagnosis. I'm sorry, it just isn't. And I don't see how you can get an insurance company to agree to paying for your medications. Even with insurance reimbursement, you're looking at monthly costs of somewhere between $5,000 to $1,000. You know, it just depends. If you get it from a compound pharmacy, similar, it's gonna be between $500 to $1,000 per month. Like, that's a freaking house note. That's a car note. Is that worth it? Do you want to do this for the rest of your life to maintain this weight loss? You need to kind of be real with yourself, right? You know, what I want. Is this a short-term thing? Is it a long-term thing? The purpose of the medication was for diabetic patients. Like, those are the patients that need this medicine. It's not someone who just, oh, I want to lose weight because I keep eating, like, I don't understand why I'm losing weight because I'm eating pizzas and hamburgers all the time. I don't understand it. Come on, really? Be real. Let's be real with yourself. Like, you're trying to lose 15, 30 pounds because you're overeating, you have poor lifestyle choices, you don't exercise. That's the reality of it. You need to make better decisions in your lifestyle. And so what's happened is that this medication's come into society, and it has been basically like a magic bullet. Like, people are losing, you know, 10, 50, 60. I've seen it all over the place. I've seen people who have no tolerance for it. Like, they cannot take it. They just feel too bad. So when you order this medication, you know, you can find them all over the internet. You can find them, you Google search Ozempic, and I guarantee you're going to have a bunch of paid sponsors of these companies making this medication with these associated programs for weight loss. I mean, who is prescribing it? I don't know. They find some physician just to sign off on it. Never seen your person. It's all telemedicine now, unfortunately. So you don't. It's not the standard of care, in my opinion, as a physician. So once you get this medication in your hands, they kind of give you instructions on how to do it. There's so many factors associated with medications that people just don't know. Like, let's talk about the side effects that they usually don't know about. It tends to cause a lot of nausea and vomiting. I've had patients say they could not tolerate, because just randomly they throw up, just randomly, like for no reason. They just get sick. They were like, and they go run to the bathroom and they're throwing up. It's the way the receptors are in the stomach, and it slows down the gastric emptying of the intestines. It slows it down. So you can have food that you've had in your stomach from yesterday. It's kind of gross, right? And you're throwing it up just randomly. In a car, feeling throw up, pulse out around, throw up. I've heard those stories a couple times. Everyone has a different sensitivity to it. You know, how you start, you don't start like, you know, on a big dose. You actually start on a low dose, and you kind of titrate up based on the side effects tolerances. Sometimes you take other supplements to help decrease the nausea, which, again, you're taking another medication to mitigate another medication side effect, which doesn't make a lot of sense to me. I've seen people have issues with heartburn because, again, you have food in your stomach and you're sleeping and you get this terrible heartburn because you've had food in your stomach for like 24 hours and hadn't moved anywhere. And so they have to sit up more, and it's very uncomfortable. They're losing sleep. They're waking up more constantly. It's just very disruptive to the sleep that translates into your day. You start feeling more grumpy. I had people tell me that they have this crazy food aversion, just the smell of seeing something. Like, just makes them like immediately nauseated, and they can't tolerate it anymore. I've had people say that that they've lost a lot of weight, and then all of a sudden it stops for no reason, and then they don't understand what they're doing, and then be another 2 weeks and they start losing weight again. It's not consistent. It's very interesting. It's just, again, it's all patient dependent. I'm just telling you what I've heard from taking care of patients who I know have been on this medication. Another one is skin changes. I don't know the mechanism of it. I don't have suspicion with the mechanism of it. The skin changes for some reason. Has something to do with, I think, maybe the hydration effect of the water being associated to the gastrointestinal system to process the food slower, because now the food's in your intestines longer, and then the bacteria are involved. The microbiome has more time with the food now, so things change hormonally, which is, a lot of people don't quite fully appreciate the microbiome of the intestines, how important it is to the function of our body. But it does change something to the skin. You'll see it's just a little bit drier. They don't quite as hydrated. There's something associated. We don't quite understand it. Another thing is that patients come to me a lot now for this thing called the Ozempic face or Ozempic butt. Super common. You know, it's people lose like 50 pounds like within three or 4 months, and they're like, why is my face deflated? You know, it's like the diet phase for someone who in bodybuilding going through prep. It's the same thing. You lose fat in your face. I lost my butt. Of course you lost your butt. You lost all your fat. I mean, what do you think is going to happen? You lost 50 pounds. Your butt's never going to look the same. And then what they really don't tell you, this is one of my top ones, is that the weight loss associated to Ozempic is, to me, disproportionately associated to your muscle mass loss. Like, you lose muscle mass like almost forever. People don't fully appreciate that when they lose weight with this medication for, you know, a period of time, like the longer you're on it, the more muscle mass you're going to lose, because you're eating less, you're taking in less calories. Your body is trying to, in a state of constant homeostasis, trying to survive. And so it needs calories to maintain normal life, which is to maintain your brain and your liver and your kidneys. Those calories have to come from somewhere. And when you don't have any fat in your body, which is our caloric storage, guess where it goes to next? It goes to your muscles, and it starts to catabolize muscles. And so you start decreasing your muscle mass with your legs and your arms. And so people who are on Ozempic, you kind of see them. They just look a little bit thinner and just frailer looking to me. And I can kind of pick you out now. To me, the long-term consequence of it is the muscle mass loss. And I've seen some really prominent people talk about this, about metabolism and anti-aging and wellness. And I would say most of them would agree that, you know, after the age of like 40, you're losing like 1% of muscle mass for the rest of your life. And muscle mass associated to longevity is incredibly important. The more you maintain your muscle mass in the long term, as you age, the healthier you'll be in the long run. It's one of the secrets to longevity, is maintain your muscle mass. And that's why one of my podcasts we talked about that. It's, you know, weight training maintains muscle mass. It maintains your tendons to be strong, which translate into maintaining your skeletal structure to be strong, which translates into you not getting brittle bones as you age, right? It maintains your metabolism. You're able to eat more because you have more muscle mass. I'm not trying to tell you to try to be a bodybuilder. I'm telling you maintain muscle mass for longevity. You will be healthier longer. You will live longer if you maintain your muscle mass. So when you take Ozempic and you do it, let's say for 6 months, you lose 50 pounds, and you're doing it in your 40s, man, you just took a massive hit in your longevity. You took a huge hit, because already you're already behind the curve because you're already in your 40s. You already don't weight train, you already don't exercise, that's why you're on the medication. And then you take another hit at it by taking this medication, you lose even more muscle mass. So I'm telling you, these people, it's in the long term, it's going to be very detrimental on the longevity. That's a problem, unfortunately. They also don't tell you that this medication is temporary, it's not permanent. It's not a permanent medication. You should not treat this medication as a lifetime medication. It is just not a magical bullet. I've met a few patients, and I'm sure they're going to comment on my comment section a lot. Well, I took it for 6 months, and I'm doing great. Man, I'm so proud of you. You're one of the few. You're the rare exception. I'm telling you, because the idea, in my opinion, is that we want to get you on the medication. We're going to change your lifestyle. That's the important concept of medication. It's all about lifestyle change. It will have side effects with food that tends to cause more nausea and vomiting, or maybe even complete food aversion, right? Like that pizza or that hamburger or like that cake. Like you just don't want to eat it, right? That's a lifestyle change. If that sticks and you're not on the medications, then you're winning, right? Because you're not eating those bad foods. And you know, it teaches you might want to, okay, now I'm a little bit leaner, now I can feel more comfortable exercising. Great. And then guess what? You introduce exercising into your lifestyle. And then the idea is to get you off. Like, we want to get you off the medications, you establish a new lifestyle, and you're able to maintain the weight loss. What they don't tell you is that once you stop the medication, is that the incidence of people regaining weight after the stoppage is incredibly high. I mean, what do people expect? Of course you're going to gain the weight. You just stop taking the medication. But they also don't tell you that there are actually probably some permanent long-term side effects that will take months, years to kind of fully get over. Like the intestinal system to work more normal again. Like, I think that's going to be more permanent than most people think. And that leads me into my next very important concept, is that there are no long-term studies associated to weight loss and semaglutide. There's none. Zero. There's none. And guess what? Everybody's been taking this medication from 2022. Guess what you are? You're the lab rat. You're the lab rat. All this data we're getting on these long-term complications, associated medications, taking really a mega dose of this peptide for long-term, all that data is being collected right now. You are the lab rat if you're taking this medication. Because we don't know. There is no long-term study. Like, this is the reality. This is what people don't tell you. Like, so again, if you're going to take this peptide, you need to be aware this is not a lifetime medication. I want it to help me reestablish my lifestyle and, you know, making better food choices, making better food proportions, and then exercising. Like once we can get you, reestablish your lifestyle, then you'll have long-term results without this medication. And that's really the optimal goal. Is you don't want to be on medications to maintain weight loss. It is not a lifetime medication. Please, please, please don't do that. Here are my top predictions for 2024 associated to Ozempic. Number one is that I think there's going to be a good percentage that have people actually gain weight, more so than when they took it. Similar to other weight loss fads, I think they tend to gain weight more. I predict that there's going to be also another significant subset of people that take this medication that are fairly effective with it, and they actually can maintain the cost of the medication in the long term, and they're able to be at a lower dose to kind of maintain it, hopefully, in combination with some of the lifestyle changes they made. But they've lost a significant amount of weight. For the past year, since 2022, I would say, when it first started. But I've already seen in 2023 I think for 2024 it's going to be bigger, and that's going to be that there's going to be a massive need for massive weight loss contouring skin surgery, where you have so much deflated skin, ton of laxity, and there's no magic laser, there's no magic creams, there's no magical red light to make it tighten up. It just won't happen. That's my job. And so what we do is I'm doing more of these contouring surgeries for weight loss, which is like a tummy tuck for extra skin of the abdomen. For thighs, you have extra skin. We're doing a thigh lift. For arms, doing arm lifts, back lifts, breast lifts. You lost fat in your breasts, and so now your breasts are deflated, and you want them more perkier. You have a brand new body because now you're 50 pounds less, and so of course you're gonna have deflation. Of course you're gonna have a little more laxity of skin, and the older you are, the worse it is. And so this is going to be an effect of this is the consequences. Maybe they don't tell you that. Like, what am I going to look like when I'm 50 pounds lighter? Is my skin going to be tight? Some people shrink down fairly well, some don't. Same thing for gastric surgery. We're still taking care of patients who've had gastric bypass surgery or gastric banding or sleeves. They lose 50, 100 pounds of fat. Guess what? They have skin everywhere. This is what happens. You should prepare. If you're okay with the extra skin, great, good for you. You don't need me, I'm good with that. I don't, it's up to you, it's your decision. But if you don't like that, and you're tired of tucking your extra skin into your pants, and you just don't like the skin folds and the rashes, well, again, that's what we do. I think there's going to be a dramatic increase in 2024 of skin removal contouring surgeries and plastic surgery. Another thing for 2024 is I think the FDA is going to start kind of stepping up, and they're going to start producing more regulations specifically associated to compounding pharmacies. Right now, the compounding pharmacy market is just a Wild West. They're making all kinds of crazy stuff now, and you just don't know what you're getting. It could be semaglutide, it could be some kind of version that they're making of it. You have no idea where it's coming from. And I think the FDA has a lot on their plate with the compounding pharmacy market. But at some point, for patient safety, once we start seeing more long-term studies come out with patients been on us in 2022, and we start seeing some of those long-term complications associated to it, I think the FDA is going to be kind of forced to kind of make some regulations on the compounding pharmacies. And I actually look forward to that happening because I think it's out of control at this point. Another prediction, I think, is that I think there's going to be some people who have no tolerance to the medication. They just don't like the nausea. They don't like the heartburn associated. They don't like the sleeping, and they just don't tolerate it well. Why aren't you tolerating? I don't know. If you're trying to eat your normal fatty, spicy foods on this medication because you're eating less, you're oh, I might freaking eat a hamburger just once a day. Of course it's gonna make you feel bad. Of course it's not gonna make you feel bad. You can't eat a slice of pizza. It's just, it's not gonna work. I think the ideal diet is going to be more like bodybuilding prep food, where it's very clean carbohydrates, complex carbohydrates, simpler proteins, less grease, less fat, less spicy. Those kind of foods are more tolerated with this medication. And I think there's going to be a trend back to gastric surgery. I think you'll start seeing patients saying, I can't do this medication. Maybe I should get a gastric surgery, right? And then the gastric surgeon, I think, will be probably more in business, probably the end of 24, early 25. Because right now they're all freaking out because crap, where did our patients go? They're taking this medication. Well, I think that's going to come back. I think the long-term studies of gastric surgery are probably a little bit better studied and better understood than the long-term studies associated with this medication, which again, we don't know. We have no clue what's happening in long term. Another prediction is that I think there's going to be more of a trend for this medication being prescribed for short-term use versus this lifetime concept, like you're going to take this medication for life. I would not recommend that you do that. I think there's going to be more of a trend for just short-term use. Patients want to get ready for summer. You know, you take this medication really for vanity. You know, I want to lose 10 pounds before the summer. You take your medications for 6 to 8 weeks. You know, you lose 10 pounds. And you're able to maintain, you look great for summer, and then you kind of get, you know, a little bit heavier in the wintertime, and then boom, you're back on it in the spring. So I think it's going to help some patients make those, you know, decrease their portion control, better food selection. I think the short-term use of it is going to be increasing, especially for the seasons. Patients want to get ready for like a big vacation trip. They want to look good. You know, 3 months out, they'll start the medication, lose a little bit of weight, a little bit of that fluff that they gained during the holidays. And I think that's, you know, that's an appropriate way to do it. I really cannot emphasize enough that this is not a lifetime medication. It's like, it is just not. You should take these peptides, not semaglutide only. We're talking about all the peptides that are coming out of pharmacies that are very powerful medications. You need to take these peptides for short interval times, like at most, you know, 6, 8 weeks at most, come off of it, maybe come back on it, you know, and intermittently, but not constant. You should not be on these peptides constantly. It's just not a healthy thing. So make the appropriate adjustments in your lifestyle to maintain your physique and your lifestyle with that medications. So next question is, what do I look for in someone to prescribe me semaglutide? So this is a great question because this is something I don't think a lot of people talk about. One, you need to find a prescriber that actually cares and understands the consequences associated to this peptide. They've had a good experience, success stories for patients who've had this peptide, and also maybe an experience with patients who are just intolerant of it. They need to be experienced, in my opinion. You know, telemedicine is so rampant right now. I cannot emphasize enough. You need to kind of establish some kind of relationship with a physician who understands the medication and the side effect profiles associated, to actually care. You know, not just take your money. There's so many programs out there. I mean, dentists are prescribing this medication. It's just, it's so disheartening. And if you are going to get prescribed this medication that is not the FDA approved version of it, and you're getting it from a compound pharmacy, ask that provider, where is that freaking medication coming from? Like, what compound pharmacy is making it? Very important. Because again, they're not all created the same. I'm telling you people, it's a wild west right now. We have no idea what they're doing out there with these compounding pharmacies. Compounding pharmacies can make good products, and I totally give them that. There are compound pharmacies that are able to prescribe nationwide, and those are the ones I would be somewhat okay with. If you know that medication came from a pharmacy that has approval to ship their medication across the country, I think they are more regulated. I think they actually care. They've done the extra work to make sure that their products are safe. And they're able to provide a product that's very consistent and reliable and good outcomes without contaminations and blah, 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 blah. So look for that. Make sure you ask the provider, where's my product coming from? Did it come from India? Oh my gosh. Was it made in the States? Is it able to be shipped across the country? You need to have that if you're choosing the telemedicine route. If you see a physician in person, that would be an ideal situation. See your physician in person, talk about this, you know. How long am I going to be on this medication? Can I just take this for a couple months? What are my goals from it? Am I trying to lose 100 pounds? You know, realistically, how fast can I lose this weight? You know, what are the consequences of losing weight? You might have tons of extra skin. Yeah, you're going to have good chance you're going to have a lot of extra skin if you lose 100 pounds. Very good chance. And what are you going to do about it? What are the options from that? And these are the things that people don't talk about. So I'm going to get off my soapbox, but I hope you learned something. It's a great topic, and I love to get your comments and your feedback. Don't forget, click on my subscribe button down below, and we'll have the next topic coming up soon. Thanks for following.